The provider portal is a secure web-based platform. Use this tool to support eligibility inquiry, authorization submission, claim status inquiry, and a number of clinical applications. The purpose of this guide is to provide an overview of the key features and functionality offered by the secure provider portal. The guide also explains many ways to use the site to get the most out of the resource. If you need additional support, contact provider services. Some administrative tasks that registered users can do include: check eligibility, view the specific benefits for a member, view benefit details including member cost share amounts for medical, pharmacy, dental, and vision services, view demographic information for the providers associated with the registered TIN such as office location, office hours and associated practitioners, update demographic information, such as address, office hours, etc. View and print patient lists, primary care providers. This patient list will indicate member's name, member ID number, date of birth, and the product in which they are enrolled. Submit authorizations and view the status of authorizations that have been submitted for members. View claims and the claim status. Submit individual claims, batch claims or batch claims via an 837 file. View and download explanations of payment EOP. View member's health record including visits, physician, outpatient hospital, therapy, medications, and immunizations. View gaps in care specific to a member including preventive care or services needed for chronic conditions. Send secure messages. Using the provider landing page. Once logged in, the dashboard displays with access to recent claims, functions and controls. Let's look at an overview of the landing page. You can perform the following tasks from the dashboard. Please note, features may vary by health plan. Main toolbar options, eligibility, verify patient eligibility. Patients, view and print your patient list, PCP/PMP. Authorizations, submit and view authorizations. Claims, submit, view, correct, copy, void or recoup claims. Messaging, send and receive secure messaging. TIN and health plan selector, switch between multiple provider tax IDs and the corresponding products. For example, Medicaid, Better, Advantage plans, behavioral health or MMP. Moving over to the provider dashboard options, the menu options are: access additional functionality, such as manage accounts and view provider-related reports. Eligibility quick check, check the eligibility of a member. Recent claims, view the last 5 claims submitted on the portal within the last 24 months. Managing account details. From the Account Details screen, you can view and manage information related to your account profile. Add and manage tax identification numbers (TINs) on the account. To access the Account Details screen, use the main dashboard. Select the drop-down arrow next to your name in the upper right corner on the screen. Choose Account Details. The Update Account Information screen appears. Use the Update Account button to access the account for updates. The Update Your Information screen appears. Make any needed updates to your account information. To change your password, click the Change Password link under Account Details. Follow the instructions on the Entry Key ID Change Password screen. Account Details, manage your TIN. TINs added to your account display in a list under your TINs section. You can mark one primary TIN to appear by default when you access the dashboard. You can also remove TINs from your account. To change your default TIN, select Mark as Primary, next to a different TIN. To remove a TIN from the account, select the X next to one you no longer want. Account Details, modify demographic information about a specific TIN. Select the individual TIN. Select the name to update information about one of the associated providers. A list of possible service locations appears. Select the name associated with the address. Select Edit Location to update the provider information. Click Edit Location to update the provider information. Note: this information will update the Find a Provider website. The following transaction attributes will be available for edits. Note: only one update within a transaction set is allowed per day. Update address, phone number, and yes or no for accessible to people with disabilities. Save changes by selecting the Save Location button at the bottom of the screen. Note: if any additional updates are necessary, please contact your provider relations representative. Enter the name for the TIN and the tax ID number. Select Add TIN. Note: if the TIN entered is not found, the above message appears. Each new TIN added will require verification from the health plan and can take up to 48 hours to complete. Managing users. The user management feature helps account managers manage their office staff or users associated with their practice. You can disable or enable users, and manage permissions for your account. To access the user management screen, select the drop-down arrow next to your name in the upper right corner. Select User Management. Select Update User to the right of the username. The Support User screen appears with the user and profile information for the selected person. Select Send Invite. You will see confirmation that invite is sent. Modify user permissions. Select or Clear can access the checkbox. Selections determine what the user can access. Select Update User when finished. All changes take effect immediately. You will return to the Support Users screen where you can manage additional users. Assessments, ability to complete and submit HRA or NOP forms. Authorizations, ability to view or submit authorizations. Claims, ability to view claims. Eligibility, access to check eligibility. Health record, access to health history including visits and medications. Access to all functions within the secure portal, and access rights as the administrator for that TIN. Submit update user to finalize changes. Eligibility, access eligibility information for a patient. Verifying patient eligibility. This check verifies if the patient is eligible for care. To access the eligibility check screen, select eligibility from the top of any screen. To look up eligibility information for a patient, enter the following information: date of service, if it is not today's date. Member ID or last name, date of birth of the patient. The green thumbs up icon verifies that the member is eligible for care. A red thumbs down icon verifies that the member is not eligible for care. Click Print for printed eligibility details. Verifying patient eligibility. This check verifies if the patient is eligible for care. To access the eligibility check screen, select eligibility from the top of any screen. From the eligibility check screen, select the name of the member linked under patient name. You can view patient information, eligibility history, PCP information, view PCP history, EPST, care gaps, and allergies. Select View Clinical Information at the bottom of the Overview tab. Details available include 3 most recent ER visits, 3 most recent inpatient admissions, 3 most recent office visits, top 5 most occurring diagnosis, and recent pharmacy activity. Overview screen. This is an overview of all information. Cost sharing, the patient's portion of healthcare costs not covered by the plan. Assessments. Any available assessments for this member will appear, as well as notice of pregnancy if gender and age appropriate. The Health Record tab allows you to view a record of visits or medications for the patient. Admission discharge. Transfer ADT for all Well Health plans only has access notes to admission discharge. Care plans are created by the health plan's case manager to help manage the health of the patient. The Authorizations tab of the member record allows you to view current authorizations and create new authorizations for the member. The Referrals tab allows you to send a member to specialized services. The Coordination of Benefits (COB) tab displays the other insurance information for the patient. The Claims tab of the member record allows you to view any recent claims for the member and also create a new claim. Document Resource Center, view and upload documents for quality management or medical necessity. Notes, upload notes of any type and review previously submitted notes. Select the Cost Sharing tab to access cost sharing information from inside the member record. This sample screen shows a member without cost sharing. Select the Cost Sharing tab to access cost sharing information from inside the member record. This sample screen shows a member with cost sharing. Member Record, Assessments tab. Select the Assessments tab to access an assessment from inside the member record. To add an assessment to a patient's record, select Fill Out Now, to the right of the assessment. Enter your responses. Be sure to complete all required fields. Submit the assessment. To view previously submitted assessment responses, submitted assessments appear in a column on the right under Previous Assessments. Response information is available to view for any linked assessment. Select the link for the name of the assessment you want to view. The responses will display. Select the back button to return to previous screen. Member Record. Health Record tab. Information displayed in the health record is based on the last 24 months of claims data. Allergies records are the exception. Information is self-reported by the member. Select Health Record tab. To access the member's health record, click the Health Record tab. The following records are available: visits, medications, immunizations, labs, and allergies. To view visit details, the visits screen is the default record on the Health Record tab. Some examples of patient visits include an office or emergency room visit. Select the primary diagnosis link. More details about that diagnosis code displays. Back to visits will return you to previous page. To view medications details, select the Medications tab to view medications prescribed for the member. To view immunizations details, select Immunizations to view any vaccinations received, i.e. hepatitis, influenza, etc. To view lab details, select Labs to view testing results, i.e. Comprehensive Metabolic Panel, CBC, etc. Select Procedure link for more details. To view allergies details, select Allergies to view allergy information. Note: allergies are self-reported and will only display if provided by the member. Examples of allergies include sulfa, codeine, etc. Member Record. Care Plan tab. 3 types of care plans can display. Medical care plans, most common, includes medical terminology. Member-centric care plan, self-management in the title, also displayed in the member portal. Free test care plan, created by Cases Manager without a template. Select Care Plan tab. Example of member without a care plan. Example of member with a care plan. Member Record. Authorizations tab. Create a new authorization or view previously submitted authorizations from within the member record. Select Authorizations tab. Available authorization information, status, authorization number, from date, to date, diagnosis, authorization type, service. To view authorization details, select the authorization number. The details display. Select View to see more details. The Notes and Attachments screen displays. Select Download for each file. Close when done to return to Authorization Number Details screen. Select Back to Authorization List when done. Note: all processed prior authorization requests submitted within the last 90 days will display the status, authorization ID, member name, date range for services, authorization type and service. Member Record. Authorizations tab. Create a new authorization. To create a new authorization for a member, select Create a new authorization. The authorization for that screen opens. Note: you are already viewing a member's information on this screen. When you click Create a new authorization from here, the authorization screen appears and the member data is pre-populated. About the authorization form. The authorization form has 2 sections. The left panel displays who the authorization is for, instructional message, and definitions. The right panel is where you enter data for, provider request, service line, and finish up. Complete the authorization form by entering details for each step in the right panel. Select the authorization type. Select the service type. The requesting provider search box appears. Enter the provider's last name or NPI number. A list of provider names and locations appear. Select Next. Enter the primary diagnosis code. To add additional diagnosis, click T+ sign. The diagnosis field appears. Now enter the ICD code. Select Next. Enter facility NPI or name. Choose the name of the provider at the location that matches your search. Scroll down on the right panel. The second service line displays the provider information, service dates, days, visits, units, procedure code, and place of service. To add additional service lines, click on the plus sign. The service line field appears. Select the desired day range. Select place of service. Enter primary code. Select Next. Finish Up. The Finish Up auto-populates the user's name, phone, fax and email address. The questionnaire that displays will vary based on the service type selected. Enter NA if additional information is not applicable. Scroll down for the Submit tab. Select Submit. A success message appears. Click the X to close the window. Member Record, Document Resource Center. Providers can review and upload documents for quality management or medical necessity for a member's record. To access the Document Resource Center, select the Document Resource Center tab. You will start in the Document Upload section. To upload documents, select the document category. Select document type. Upload file, select Choose File. The file name will be the document name. The file will appear in the Browse window. Select Submit. The file accepted, success message appears. To review documents, select Document Review. Select document category. Select date range. Select Search Documents. Member Records, Notes. The Notes section varies by health plan and allows providers to upload notes of any kind to a member's chart. Review previously submitted notes already uploaded. To access notes, select the Notes tab. Any previous notes will display. To add a new note, select Write Note. The General Note screen appears. Select the category of note you're creating. Enter date. Type your note in the note box. Select Submit. Your note appears under Previous Notes. Note: the user will be able to create a generic note for the health plan. The health plan will be able to follow upon the request and store the note within the health record of the member. Member Record, ADT notifications for all Well Health plans only. The Admission Discharge, Transfer ADT notifications display for the last 12 months. To access Notes Admission Discharge, Transfer ADT notifications, select the ADT tab. Member Record tab, Managing Referrals. To access referrals, select the Referrals tab. To submit a referral for a member, select an available specialized service option from the Source drop-down menu. The referral form auto-populates the date, time and user's name. Complete the phone number. You can add an extension if needed. Add additional comments. This is optional. Click Submit. You will receive a message that your referral was submitted successfully. Member Record tab, Viewing Coordination of Benefits COB. To access the member's coordination of benefits information, from inside the patient record, select Coordination of Benefits. Example of No Coordinate of Benefits, COB. Here is an example of Coordinate of Benefits COB which displays termed and active insurances. The Claims tab of the patient record allows you to view any recent claims for the patient. You can also manually create a new claim. If the patient has any recent claims, they display on this tab. To access claim information, select the Claims tab. To create a new Centers for Medicare and Medicaid Services CMS claim, select Create a New Claim on the right. Select the type of claim you want. In the General Info section, enter the patient's account number and the other information related to the patient's condition. Claim field tabs. The display line items on this electronic form reflect those on a CMS 1500 paper form. Hovering over the claim field tabs to the right of the screen will help determine what field on the CMS 1500 paper claim form from which to obtain the information. Enter statement date range. Select Next. Enter diagnosis code. Select Add Coordination of Benefits to include any payments made by another insurance carrier, if applicable. Enter the carrier type and policy number. Select Next. Select Next. Adding service lines to the claim in the Service Lines screen, add your service line information. When entering charges for the service billed, include the decimal point to ensure the data displays accurately. For example, 99.0 converts to $99. To add additional service lines, select the Save/Update button on the right, select the New Service Line button on the left. You can enter up to 99 service lines. Enter your dates of service. Select Place of Service. Enter Procedure Code. Select Diagnosis Code. Enter Charges. When entering charges for the service billed, include the decimal point to ensure the data displays accurately. For example, 99.0 converts to $99. Enter units/minutes/days. Select the Save/Update tab. Select Next. Adding provider information to the claim. Enter referring provider information. Clicking on Find Provider will bring you to this screen to assist you in finding a provider's information. Enter the billing provider's information. Use the Same as Billing Provider button to fill service facility location if the same. Select Next. Adding attachments to claims. You can attach any documents to the claim as desired. Skip this section and click Next if you do not have any attachments. To attach a file, select Choose File in the Attachments section. From the Attachment Type drop-down list, select the type of file you want to attach. Select Attach. Note, you must click Attach for each file you submit. Select Next. The review screen appears. For best results, use the following guidelines. You can attach the following files types: JPG, TIF, TIFF, and PDF. The file attachment size cannot be larger than 30 MB. The file cannot be password protected. Review patient's information and scroll down. Member Record tab, Managing Claims CMSUB04 Institutional Claim. The steps for managing institutional claims are very similar to those of the professional claim. The main difference is that the side field will reflect the UB04 paper form. Select Institutional Claim by clicking the CMSUB04. Select Submit. Managing Authorizations. Submitted authorizations display for 90 days. Prior authorization requests may take 24 to 48 hours to display on the authorization list. To access authorizations, select Authorization from the main toolbar. Authorizations appear based on TIN and product selected. Select Filter to search for an authorization. Enter the authorization number. Select Go. All processed prior authorization requests submitted within the last 90 days will display the following information: status, authorization ID, member name, from date to date, diagnosis, authorization type, service. To access the authorization error screen, place the mouse cursor over Disclaimer. Disclaimer text appears. Managing Claims. The Claims tool allows you to create new claims. You can also view details and manage all aspects of your saved and submitted claims. To access claims, select Claims from the top of any screen. Individual claims, list of manual claims submitted using the provider portal, clearinghouse, or paper. Saved claims, saved drafts of manual claims that have errors or missing information that have not been completed. Submitted claims, list of manual claims submitted using the provider portal. Batch claims, list of 837 electronics claim files uploaded from the provider portal ED. Only the last 24 months of batch files are available online. Recurring claims. Bulk uploaded claims template for long-term care. Complete a few key fields. All other required service line details are auto-completed for you. Payment history claims, provides explanation of payments, EOP, documents for claims. Payment history is available up to 24 months. Claims Audit Tool. Clear Claim Connection is the claims audit tool used to look up procedure code, quantity, modifiers, date and place of service, and diagnosis for a claim to get proactively before you submit or retroactively after you submit a claim to get coverage. Upload 80 claims, tool to upload 837 electronic claim files from your shared drive or other locations. Select Individual tab. Select the blue claim number to open that claim. Fields include claim number, type, member name, service date, billed/paid, claim status, and Medicare claim. Claim details: you see services were covered or denied, view the payment amount, date and check number. Copy claim, copies the information in the existing claims into a new claim. Using the next arrow, proceed through the claims screens, updating any information that may differ. Review your claim and submit. Select the Correct Claims tab. Using the next arrow, proceed through the claims screens, correcting the information you may have omitted when the claim was originally submitted. Review your claim and submit. Select Void/Recoup claim. Review claim for the appropriate information that should be voided. Review your claim and submit. To reconsider a claim, use Reconsider Claim to provide documentation in support of a paid or denied claim. Providers are not to use this tool for appeals. Select Reconsider Claim. The Reconsider Claim pop-up window displays. Note: the Reconsider Claim button will be visible unless a web-initiated reconsideration is already in progress. From the drop-down menu, select the reconsideration type you want. Add notes or upload documents as required. Note: the Reconsider Claims form is dynamic. Depending on the type of reconsideration selected, notes and/or documents may be required. Select Submit Reconsideration. Upon submission, a success banner displays. The Claims Tracker screen updates to reflect that a reconsideration is in progress. Note: the Reconsider Claim button is no longer available. Once processing begins, the reconsidered claim details appear on the tracker. This is what a reconsideration screen will look like. You will be able to complete the following steps to achieve success with reconsiderations. Once processing begins on a reconsidered claim, the reconsideration details table appears on the claims tracker. You can access reconsideration claims details from the Individual tab. Click the blue claim number to open that claim. Check the status of a reconsidered claim by viewing available on-screen details and attachments. The reconsideration details table has one entry per reconsideration and includes created date, type, current status, reference number. To view and upload additional attachments, navigate from the reconsiderations details table where you can view and attach additional references to ongoing reconsideration cases. Select the paperclip icon. The Upload and/or View Files window will appear. To view previously uploaded files, select the document name to download and open the file. Files will appear with the original file name and appended date. Special characters are removed. To upload additional files, select the Choose Files button and select the documents you want to upload. Selected files appear next to the Choose Files button. Note: each submission is limited to 5 files. There is no limit on the number of successive submissions. Click Submit. Upon successful upload of files, a success banner displays. To view the reconsideration letter, select the reconsideration letter icon to view acknowledge and outcome letters associated to a reconsideration case. Select the document icon to open the letter. Frequency of letters is dependent on CANPA operations. Viewing Edit Saved Claims. You can view and edit drafts of professional or institutional claims. To view saved claims, select Saved. The following screen appears. Types of saved claims: draft claims, professional ready to be submitted claims, institutional claims, ready to be submitted claims. Select Edit. Fix any errors and select Next. Select Save/Update. To delete a saved claim, select Delete to the right of the claim that is no longer needed. Select OK to confirm the deletion. Note: once a claim is deleted, it cannot be recovered. Viewing submitted claims. Submitted claims are manual claims created and submitted using the provider portal only. Information is view only. Select the Submitted tab. The following screen appears. Information is view only. Viewing submitted batch claims. Use the Batch tab to view batch claims that were supported using the provider portal. Previously uploaded batch files appear at the bottom of the batch claims screen. If no batch files are uploaded, the No Data Found banner appears. The last 24 months of batch claims submission data is available online. Passing the format verification process is not a guarantee of claim or claims payment. Claim or claims payment is contingent upon accuracy of data submitted. You will receive an explanation of payment EOP or 835 for your claims submission depending on your contract arrangement. To access batch claims, select Batch. The following screen appears. To search for a batch claim, you can search by one or more criteria: date, confirmation number, and batch claim status. Select the start date and end date. Note, you can only search in monthly increments. Click Search. The batch claims list updates to display your search results. Uploading batch files to EDI. Use the Upload EDI tool to upload 837 electronic claim files from your shared drive or other location. To access Upload EDI, select Upload EDI from the top of any claim screen. Select the file type: 8371 for institutional and 837p for professional. Choose File to select the batch of claims to upload and select Open to attach file. Select Submit when the file is successfully uploaded. The web reference ID hash is generated. Creating recurring claims. Recurring claims provides a bulk upload claims template for long-term care. Complete only a few key fields. All other required service line details are auto-completed for you. To access recurring claims, select the Recurring tab on the claims screen. Select Claim Type from the drop-down list. From the Location drop-down, select the address of the place of service. Select View Member List. Select the checkbox to the left of the members you are creating the recurring claim for and complete the required fields. Select Create Claim. To add a member, select the Add Member tab. Enter member ID and birth date. Select Add. Select the checkbox to the left of the members you are creating the recurring claim for and complete the required fields. Select Create Claim. Payment History provides explanation of payments EOP documents for claims. Payment history is available up to 24 months. To access payment history, select Payment History from the claims screen. The following screen will appear. Select the check date for the claim you wish to review. EOP PDF document downloads. A message will appear to warn in the case of an error. Using the Clear Claim Connection Audit Tool. Clear Claim Connection is the claims audit tool used to look up procedure code, quantity, modifiers, date and place of service, in addition to diagnosis for a claim proactively before you submit or retroactively after you submit a claim to get coverage details. The tool is also referred to as the Code Editing Assistant screen. To access the Claims Audit Tool, select Claims Audit Tool from the Claims screen. When you click Submit, the Clear Claim Connection Code Editing Assistant screen appears. Complete member information, select the gender. Enter the date of birth. Complete service-related information. All fields are required for each line item. Note, click Add More Procedures to look up as many procedures as needed. Or, click Clear to reset the form. Select the Review Claim Audit Results button. The results of the claim audit display the recommendation status of allow, disallow, or review. The results displayed do not guarantee how the claim will be processed. The information only assists in claims submittal. If the recommendation status states disallow or review, click the status for more clinical edit information like procedure code, quantity modifiers, date of service, place of service, and diagnosis code. Select the Review Audit Results. Viewing and downloading the patient list. You can view and download a patient list from the dashboard, only available for PCP or PMP. Only the following patient information appears on the screen: member name, date of birth, member ID, phone number, member number. Download the patient's list to get more details. To view the patients list, select Patients on the main toolbar. The patient list screen appears if available. To download the patients list, select Download. Select an option, Open, Save or Save As. The patient list file will either display or download. You can download a copy of the patient list in an Excel format only. To filter the patients list, you can choose the data you want to include in your patients list. You can apply multiple filters based on the provider's NPI, Medicaid number, specific member last name, or specific alert. Note: your filtered preferences are preserved in the downloaded list. From the patients list, select Filter. Select the checkbox next to the information you want included in the list. Note: if you do not make a selection, all the patient information will be included in the list. Select Go at the bottom of the screen. Sample of a downloaded patients list Excel document. To access secure messaging, select Messaging from the main toolbar on the dashboard. The secure messaging screen displays the inbox. To view and respond to received secure messages from the inbox, select on the message you want to view. Select Reply to respond to a message. Select Send to Trash. The message is moved from your inbox to the trash. To create a secure message, select Create Message. The new message screen appears. On the new message screen, select a subject from the drop-down menu. The To box displays the same plan type you selected at the top of the dashboard. If you select a different plan type from the drop-down list at the top of the dashboard, the To box automatically updates to match the selected health plan. Type a message to the health plan staff in your message. Select Send when you are done. A confirmation that your message was sent successfully appears. Manage Sent Secure Messages, select Sent. Any messages you have sent display on the left. Select a sent message to view it on the right. To send to trash, select the Send to Trash button. Note: messages sent to trash will be deleted after 30 days. If a message is not trash, but is found under the Trash tab, you can reverse it by clicking the Not Trash button.